Hello everyone, my name is Colombamwa and I'm very happy to be with you today in our Heroes in Health. You know, this is the right place to discover our heroes' life in two details. So please, I don't know where you are, but please be comfortably seated and let's get started. The person we're receiving today is someone special. He is the Executive Chairman of Africa Health Business, the President of Africa Healthcare Federation, the Chairman of Kenya Healthcare Federation, and currently serves as a director with Lumira. Welcome, Doctor.
Thank you so much.
We are so pleased to have you.
I am also very pleased that you found time for me.
Oh, thank you. And I know we're going to learn a lot from you today. So quickly, the first question we feel like asking you is, who are you?
Right. So my name is Dr. Amit Thakker. I'm a third generation Kenyan living in Nairobi and working in the health industry. I studied as a medical doctor and qualified in 1995. My first business in healthcare was in 1996, and I started a chain of clinics known as Avenue Healthcare, and my foray into the healthcare business and healthcare services began since 96. So I've been in the industry for almost 30 years, providing private health services to large populations.
But you've been so fast with us because we really need to go like in your life into real details, you know. So tell me, after university, what did you do? Who was your role model?
Right.
Yeah.
So during university, which was a 5-year course to become a doctor,
all right.
In my 4th year, I realized that affordable healthcare was a major problem. And many people find it difficult to afford private health services. It is then when I started thinking about starting a mobile clinic. Immediately after my university, I opened up a mobile health service where I converted a van into a clinic. Like I put a couch, I removed the seats, put a couch, put a small pharmacy, and my work at the time was to drive the van and go to companies. Rather than waiting for patients to come to the clinic, this was a different way of taking healthcare to the people who work in large and medium-sized companies and factories and farms. That's what Avenue Healthcare was.
Beautiful idea. I don't know how could you think about such a different idea from what we used to see, but tell me, when you were a child, were you dreaming about such things before, or was it just in your way throughout your studies?
I always wanted to be a professional.
Okay.
And I wanted to offer services. There were times in my life I thought of being a pilot, and there were times I was thinking maybe I'll do something in engineering. And sometime along my studies, I realized science and biology was one of my favorite subjects. And becoming a doctor was one way of providing services to the people. That's how I became a specialist in medicine.
Then how can you just mix up business and medicine?
Very good question. Along my journey where I was treating patients, I realized that economics plays a big role in mixing medicine and finance, where everything was about how much does it cost? How can we make healthcare more affordable? And that is still the current situation, as you know, in Africa.
Yeah.
And when I started the business, it was very clear that I had to understand how to make the funds go into the clinic and how much to be spent. And I did a master's in business administration. So doing an MBA was also an added value of modeling unique and innovative businesses around the healthcare space. And I found that mix to be very exciting and to be very useful, because private healthcare is half the healthcare in Africa.
Yes, this is true. Private healthcare is half of healthcare in Africa.
Yes.
But about the technology, you know, we into a world where technology cannot just get a bit away of our traditional work, you know. So how do you use technology into your workplace?
So technology is the best secret recipe to improve healthcare in Africa.
Explain us.
The use of mobile phones
All right.
has become ubiquitous. And if you look around the continent, everybody's holding a phone. Soon, many people will be holding a smartphone. Using mobile health, creating awareness, improving preventive healthcare, and having money on your phone, giving you the digital health money, will allow you to access services. You don't need to go to a bank to bank. You don't need to go to a shop to shop. And with the phone, you don't need to go to a doctor to be treated.
Yes.
And the advent of telemedicine is here with us. Not only paying for healthcare, but seeing a doctor. You could be in Abidjan, but you could be getting a specialist services from Johannesburg, and you don't need to travel. So within different cities and different countries, you will be able to get specialist services. Don't forget that artificial intelligence is going to improve quality of healthcare dramatically. And AI is just coming. It's very new, but maybe when we are here 10 years later, every clinic and every doctor and every facility will be using AI to make quality of services better.
Wow.
That will change everything.
I also do believe it, but can you just tell us the issues you've been through from that time to now?
The main issue that we've been through is to find ways in which medical insurance and payment mechanisms can become as easy as possible for households and people. So in the early years, I started treating patients for a fee.
Okay.
It was clear that we needed to stop that. So instead of asking them to pay every time they're sick, we gave them a membership plan. Through this plan, they would pay a small fee and they would be covered for the full year. And they could have come to our clinic as many times as they want.
Wow.
So it was an unlimited medical cover for themselves, for their families, and this managed to give them easy access. So that was one challenge. How much do you charge, and how can you cover the whole family for medical care? The second one was I needed to find as many good qualified people to be treating the patients.
Yes.
So finding the right doctors, nurses to be employed in the clinics was always a challenge. When we started, we were 2 staff, and within no time, we were now at about 800 staff, treating about 30 to 40,000 patients a month.
Wow.
And that is how we began the original services.
I wanted to ask you, when did the idea of, joining the federation came into your
Very
mind?
good, very, very. So this was around 2004 and 2005. There was a bill in Parliament. As we know, health is very political. And there are many laws made in countries. Some of them are good, some of them are not so good.
Yes.
And in Kenya, there was a law in Parliament that was known as the National Social Health Insurance Fund. And we were happy with the idea, but we were opposed to some of the clauses within the bill. So we started talking to government
Okay.
and asking them to change some clauses.
Okay.
The government would only listen once you are a larger voice.
All right.
They don't listen to individual voices.
Wow. Okay. All right.
That's when I realized we needed an apex body or an organization that speaks for the private sector. In countries where you don't have a voice, the government will never listen to you. So we needed to create a voice. And the best way to create a voice was to create an association or a platform or a federation or an alliance. So Kenya Healthcare Federation was born in 2008 to be the voice of the private sector. And since then we succeeded. And we've gone country to country, region and to region. And now we have a continental platform known as the Africa Healthcare Federation. And in that, we have two regional platforms. One is called FOAPS, which is the West African Private Healthcare Federation. And the other one is called EAHF, which is the East Africa Healthcare Federation. We are working on North, Central, and South. So eventually we'll have 5 platforms speaking with one voice for Africa.
So covering the whole Africa?
Yes.
Wow.
Yes.
What about in Kenya? Are you able to cover even the regions where poor people are living?
Yes. When we speak for the voice of private sector, remember many non-state actors or private sector treat poor people. They treat people in the rural areas. There are many smaller clinics and remote facilities that need to be having a voice. So they all have a voice in the federation, whether they are working for the urban or rural areas where they come and give their problems and challenges. That's the role of the federation.
Talking about remote facilities, I wanted to ask you, what do you think about medical tourism?
Look, medical tourism is growing and the demand is also becoming larger because everyone in Africa is becoming more aware where to look for good quality of care.
Of course.
And many times you find people traveling outside Africa to receive care for 2 reasons only. One is they feel that they'll get better quality of services outside Africa. And the second is the cost is lower. They feel sometimes people in private sector are charging too many high, the fees are very high. So quality and cost make people travel. They used to travel to UK, Europe. In fact, some even travel to US. But now there's only one country that takes 90% of our medical tourists from Africa. And that country is India. India has become the largest winner in providing services to Africa. Can we change it? Yes. How do we do that? We just need to improve the specialized quality services in Africa and make clear which are the specialist centers in Africa that offer these services. So we can have Africans traveling within Africa and they don't need to leave their country or the continent for good quality care. I hope we can do that soon.
Hopefully.
Hopefully.
Hopefully. This is all beautiful, Doctor, you know. Well, I feel like asking, doesn't the Federation has any weaknesses?
So remember, yes, it does have weaknesses. Let me mention a couple of them.
Okay.
The first one is membership.
Okay.
Remember, membership in the Federation is voluntary.
Okay.
That means only if you feel like joining, you join and you pay your fees. And many of the private sector organizations in healthcare don't join the Federation in the country. So the membership seems to be limited, and over the next few years, we want to expand the membership. That's the first one. The second weakness is getting the government to listen to the Federation. We had the Honorable Minister, Timba, here today, which was a very good sign. That shows that there is dialogue and collaboration between the Côte d'Ivoire Ministry of Health and the Côte d'Ivoire Federation. That should continue. Once there is dialogue, then you develop a trust. When you develop a trust, you are able to have PPP, true public-private partnership. That's the second challenge. Not every country has ministers who are clever.
Yes.
Or who are able to listen. But many African countries have got super ministers these days. And the clever ministers know exactly how to work with the private sector.
Okay.
And not all of them are clever.
All
Many
right.
of them don't know exactly how to work with the private sector. And that is what creates a mistrust and a weakness. So the federation have to work harder to work with. That's the second challenge. And the final challenge is to find a sustainable way to keep the federation afloat with funding and have enough partners like USAID. I'm really delighted to see USAID here in Côte d'Ivoire that is working together with the members and the federation. So partners like those, World Bank, GIZ, FCDO, Bill and Melinda Gates Foundation, all these partners make the federation tick. Those are some challenges that we are facing right now.
I know you have such a busy schedule. Tell me, how do you manage your personal convictions with your work?
Getting organized, prioritizing, do the right thing at the right time, and have a good team with whom you can manage your tasks. I have a fantastic team. I understand delegation. Bring people who are smarter than you in some areas. That means you can do more. If you try to do everything yourself, it's a great way of not to achieve anything.
All right. So the good team is not just made just one a day. You just meet them up all along the way, right?
All along the way, all along my divisions, in the federation work, I have a division. In my project work, we have people. In my business work, there's people. So there are different leaders and different heads that I have the privilege of working with.
Wow.
That's how you can achieve more.
Interesting. Doctor, can you please tell us about the project, the current project of the Federation?
Okay. There are many projects of different federations.
All right.
So remember, we have almost about 27 federations. And each country has a different project. So Liberia, one of the projects they have is to do the national health insurance for their country. In Kenya, one of the projects is to look at the VAT, which is the value-added tax on commodities. In Zambia, they are looking at supply chain and how to make that more efficient. So every country has a different project. Talking about Africa, which I am currently leading, our project is to provide cross-country learning. We want all countries to learn from each other and make it a stronger federation. The second project we have is to provide one continent, one team, so that we keep the trade in a coordinated and harmonized way across Africa without borders. So we want to make it a borderless movement to have healthcare trade. So there's free movement of people, goods, and services. If we have free movement, imagine how this continent would be.
Free movement of people, goods, and services. This is beautiful to hear. Doctor, I want you to just look at the camera, talk to the public, and give them some words just to encourage them.
Look, I believe that the best way to look after health is a dual mix of both public and private. And I want to tell the viewers that healthcare does not start at the hospital doorstep, but it starts at the homestead. Look after the entire homestead. Having good nutrition, having good sanitation, and having a very clear idea that prevention is better than cure, including having timely vaccinations, you can reduce the health burden for people in Africa by a huge amount. So looking after ourselves at home, eating right, feeling right, looking after the environment. Imagine when we were washing our hands during COVID, keeping everything clean. The disease burden went down. So I don't think healthcare is defined as finding medication for every time you're ill. Keep yourself healthy. Keep yourself aware of what you can do to keep your family members healthy, because prevention is better than cure, but is also cheaper than cure.
I'm so happy today because we have received our president of Africa Healthcare Federation, Dr. Amit, and it's been a pleasure to learn a lot about you. I think I'm going to invite you next time on the stage.
Happy to.
Thank you. So please, guys, I'll just tell you, take care of yourself, stay healthy, and see you soon.
Super.